welcome Ellie. Thank you for coming in today. So we're just going to be doing what's called a pre-exercise screening. So all it is I'm just going to be asking you some questions about your health in general, just to see if there's any risk factors we should be aware of, anything that might make it unsafe for you to exercise, anything like that. And then we're just going to be doing another form as well that's going over just your goals and expectations and that kind of thing as well. So shouldn't take long, and then we can get working on your program. So does that all sound fine to you?
Yep.
Yeah, cool. All right, well, first up, your full name, Ellie Foster, yeah, cool. And your date of birth, Ellie?
21st of the 1st, 2007.
Yeah, cool. So that would make you 16.
Yep.
Yep. And you're female?
Yep.
Cool. All right, so yeah, I'm just going to ask you a few questions now. Just answer yes or no, or if you don't know, just tell me you don't know. So do you have, or have you previously had a heart condition?
No.
No. Have you had a close relative who has died suddenly from a heart condition before the age of 50?
No.
No. Any uncontrolled epilepsy or seizures/convulsions? Have you ever suffered fainting or dizzy spells from physical activity or exercise?
No.
No. You don't have diabetes?
No.
No. Any asthma attacks requiring immediate medical attention over the last 12 months?
No.
Have you ever had any anaphylactic reactions?
No.
Have you had surgery in the last month? And are there any other conditions that might require special consideration that you can think of?
No.
No? Cool. And one last question. Over the past 7 days, on how many days were you physically active for a total of 60 minutes or more per day?
I'd say about 3.
3 days, yeah. Cool. Cool. Now just signing at the bottom. Just it's a touch screen, so just sign there. Yep. Thank you. And today's date is the 30th of the 7th, 23. And you're 16, so you don't need the parent signature. So that's that one done. Too easy. And now on to the next one. So, Ellie Foster. Date of birth was the
21st of the 1st, 07.
Yeah. Thank you. Parental guardian name, please.
Julie, that's mum.
Julie.
Julie Foster.
I'm going to spell that Julie as in two. Today's date, 30th. Alright, just your address, please.
Number 12, Hill Edge, Hilledge, Lane,
Yep.
Moorabah.
Phone number?
0407 612 144.
Email address?
Ellie _Foz, F-O-Z, at hotmail.com.
Yeah. These are for your real life, if you know. An emergency contact?
So that's all just do mum. So
Your
Julie,
mum, yeah.
and number 0418
Yep.
612 607.
Yep, cool. Alright, cool. So now on to some goals. So what were you hoping to get out of your training? What's your goal overall?
So mainly just trying to get stronger.
Stronger,
build up
yeah.
my strength.
Yep.
Yeah, and core strength, upper
Okay.
body strength, and
Yep. Okay, so just to hone in on that, let's think of something specific that we can work towards, so it's measurable.
Yeah.
Because we want a clear-cut goal, makes it a lot easier to visualize the improvement and the progression.
Yeah.
So, is there a specific exercise that you want to reach a certain weight in or something like that?
Yep, so maybe like squats.
Yeah. Is there a certain weight you'd like to be able to squat?
Say around 60
kilos. Yeah, cool. That's a pretty good goal. Measurable via weight lifted. Is there a time frame you want to achieve that in?
Not really sure. What would you recommend? Like,
well, it will depend on your baseline strength level, which we're going to be looking into today with the fitness tests. Given your age, I reckon let's be realistic and set a time of 12 months, I reckon.
Yeah,
sounds
good.
You could do it in that time, I reckon. Achievable within time frame. And it is relevant to overall goal. Increasing strength. So yeah, that'll be a long-term goal, obviously. We can take a look at some shorter-term goals as well to work towards, just so we have some more clear-cut guidelines sort of thing as well. Are there any barriers you can think of that might prevent this success?
No, not that I can think of.
None. What would you say you need to be successful in this goal?
Motivation.
Motivation, yeah, that's a good one.
And consistent practice.
Yeah.
Yep.
Yeah, that's good. Are you currently exercising?
A little bit.
Yeah. So yes, but not that much.
Yeah.
Okay, so how many days per week would you say?
About 3.
3 days. Yeah, that's pretty good. That's more than a lot of people. How long are these sessions usually?
About 45 minutes.
45 minutes, yeah. Intensity, easy, moderate, vigorous. What would you say they?
Moderate.
Moderate, yeah. Any regular medication that you take? No. Okay, so a bunch of conditions here that if you've had any, just let me know. I'll just read them out to you. Any serious injuries that I should know about? Infectious diseases?
No.
Arthritis?
No.
Swelling in the peripheries?
No.
Diabetes 1 or 2?
No.
Breathlessness?
No.
Heart disease?
No.
High cholesterol?
No.
Low or high blood pressure?
No.
Chest pain?
No.
Asthma?
No.
Epilepsy?
No.
Depression?
No.
Dizziness?
No.
Feeling faint?
No.
Calf or leg pain?
No.
Osteoarthritis?
No.
Heart failure or stroke?
No.
No. Cool. Are you currently under the guidance of any allied health professionals, like chiropractor, occupational therapist, physiotherapist, anything like that? No? Cool. Health check, come back to that. Okay, so your lifestyle. Hang on, just pause it for a sec. Okay, now onto your lifestyle. So, how active is your job, if you have a job?
Probably light to moderate.
Light to moderate?
Yep.
Yeah, okay. What about your day? How active is your day?
Moderate.
Moderate, yeah. of sleep do you reckon you get most nights? Less than 7, 7 to 9, or more than 9?
About 7 to 9.
Yep. Have you been physically restricted by your health in the past month at all? No. Emotionally affected by your health?
No.
Okay, so in terms of your diet, so which would you say most accurately describes your diet? You feel that your diet is healthy and it doesn't require changing? You feel that there are a few changes you could make to your diet to improve your health? Or you feel that your diet requires a number of changes and you're not sure where to start?
I'd say probably the first one.
First one, yeah. Cool. So no nutritional consultation required then. Alright, on to your exercise plan. So how much time do you think you can commit to your exercise plan? I was going to say exercise.
Well, maybe 2 sessions a week. Is that what you recommend?
2 sessions with me is good. Ideally, you would want to in time do sessions on your own as well.
Yeah.
So I'd recommend more than 2 in total.
Yeah.
If you're talking about just with me, then 2 is fine.
Yeah.
But I would recommend probably 3 or 4 sessions in total. Do you think that's doable?
Yeah.
Yeah. So do you think 4 is doable? Or?
Yeah, I reckon.
Okay. And session time, 30 to 45 minutes, okay? Or
Yeah.
Is there a time of day you prefer to exercise? Are those options?
Probably afternoon or evening.
Yep, cool. What days do you reckon you'll train on? Doesn't I know this might change over time, so don't worry about it too much. Just a general idea. Do you have any idea?
Maybe just Monday to Thursday.
Yep. That works. Alright, so are these activities here? What fitness activities interest you?
Walking, swimming, stretching, cycling.
Where's that?
Second one.
Thank you.
Yep, that's probably it for now.
Okay, cool. Are there any personal circumstances that I might need to take into account when planning your exercise program? For example, religious practices, dietary choices?
No.
No? Cool. Nice and easy. What intensity would you like to exercise at? Low, moderate, or high?
I start with moderate.
Yeah, sounds good to me. Are there any fitness activities that do not interest you?
Nothing that jumps out at me that's probably going to impact this.
Yep. Excellent. Cool. All right. Informed consent. So, full name Ellie Foster. Cool. All right. I'll just get you signed here. Thank you. Cool. All right. Yeah. So next we'll be going on to your fitness tests, just to get a gauge on your overall health. Just to create that baseline to work from.
Yep.
So this is 4 tests. So there'll be a cardio, a strength, a flexibility, and a balance test. So I'll go through those with you now. And yeah, then we can start working on your program.
Yep, sounds good.
Cool.